name is Roxanne McDonald. I am the narrator of this audio book. I'm a Mandindangi, Durrumbul and Wangan woman from Queensland. About this radiation therapy book. This book contains information to help you learn more about radiation therapy, RT for short. It includes information about treatment planning, daily treatment, possible side effects, ways to look after yourself, and what may happen after treatment finishes. If you need help communicating in your language, ask if an interpreter is available. This page is about your support network. In this booklet, you can write down names and contact details for people who can support you, family and friends, community support, and health professional support. Your family, friends, and support people can be with you when you talk to your healthcare team. It is about your cancer care team. You will see different health professionals depending on your needs. These are some of the health professionals you might see. GP, local doctor. This person gives general medical support and local help with any health needs. Cancer nurse. This person provides care and support and explains what to expect with radiation therapy. Radiation oncologists. This person is the doctor who manages your radiation therapy. Radiation therapist. This is the person who delivers your radiation therapy. Indigenous liaison officer. This is the person who provides emotional and cultural support and organises support services. Social worker. This person helps you connect with support services. If needed, you may see other professionals for advice about what to eat, exercise or activity, voice or swallowing, or communication in your language. Facts about cancer. There are many different types of cancer, and it can affect people in different ways. Cancer can happen to anyone. Hearing about cancer can be stressful. Feeling worried or scared is normal. Many people survive cancer, especially if diagnosed early. We encourage you to share this book with your family and friends. What is cancer? Our body is made up of tiny cells we can't see with our eyes. These cells grow, divide, replace worn-out cells, and heal damages after injuries. Sometimes cells grow in uncontrolled ways and form tumours or lumps in the body. These lumps can be either benign, not cancer, or malignant, cancer. Malignant tumours are cancer. These are harmful cells that can stay nearby or spread to other parts of the body, as shown in the picture below. If cancer cells spread to other parts of the body, they can form new lumps. The first lumps are called primary cancer. The new lumps are called secondary cancer or metastasis. Different types of cancer cause damage to different parts of our body. For example, liver, bowel, lungs, breast, cervix, prostate, brain, mouth and throat, bones or blood. Types of cancer treatment. There are different types of treatment for cancer. Surgery, radiation therapy, chemotherapy, immunotherapy, hormone therapy. Some people have more than one type of treatment. This depends on the type of cancer they have. You can read more about different treatments
on page 41.
This book is about radiation therapy. Radiation therapy, RT, also called radiotherapy or radio, uses high energy rays to treat cancer. These are like rays of light. You cannot feel them, they do not hurt. Radiation therapy uses radiation, a special type of X-ray, to kill or damage the cancer cells and stop them from growing. This book is about a type of radiation therapy called external beam radiation therapy. This treatment uses high-energy X-rays from a machine to destroy the cancer cells in the area of the body being treated. About radiation therapy. Radiation therapy targets and destroys cancer cells and is an effective treatment for many types of cancer. Why have radiation therapy? Radiation therapy can be used to either cure cancer, stop the cancer from spreading, help other treatments, or relieve symptoms such as pain or bleeding. How much radiation is given? To give radiation therapy safely and to help reduce side effects, a small amount of radiation is usually given at each treatment session. The radiation targets and destroys the cancer cells, so they stop spreading, but it can sometimes damage healthy cells nearby. Having a small amount of radiation each day makes sure the cancer cells are destroyed and the healthy cells can recover. This book gives you information so you can make an informed decision about your treatment. This is called informed consent. Radiation therapy. You will have radiation therapy at a cancer centre, usually located in the hospital. The cancer doctor, also called the radiation oncologist, and a radiation therapist who delivers the treatment will work together to give you the radiation therapy safely and reduce side effects. They will talk to you about your treatment plan. How long is radiation therapy for? Some people have one or a few treatment sessions, and some other people might have up to 9 weeks of daily treatment. The number of treatment sessions depends on the type of cancer, whether treatment is to cure the cancer or manage the pain, and whether you are having other treatment. Radiation therapy treatment is usually given weekdays, Monday to Friday, not over the weekend or on public holidays. The break over the weekend allows normal cells to recover. There may be breaks in treatment if the machine needs to be serviced. This is normal. This page is about what happens during radiation therapy. During treatment, you will lie on a treatment bed or couch under a machine, as shown in this picture. The machine points the radiation beams, X-rays, to the part of your body that needs to be treated. You will not see or feel the X-rays. You will see some red or green lights, lasers, coming from the machine to help the radiation therapist to make sure you are in the correct position. The lasers are harmless and have no effect on the body. You will not become radioactive after external radiation therapy. The X-rays will not stay in your body, so it is safe to be with family, including children and friends, and continue your daily activities. This page is about what to think about before starting treatment. Getting to and from treatment can be hard for some people. It is a good idea to ask a nurse or Indigenous liaison officer about what travel assistance, transport and parking is available at your hospital. Some questions you might like to ask the nurse or liaison officer. Is there cheaper parking for patients? Where are the taxi ranks? Are there any transport or driver services? Will I need to stay close to the hospital? Can an escort or family member travel with me? Are there interpreters available? Can I request male or female staff members? What costs will I have to pay for? What will I need to bring with me? Remember to bring your Medicare card or your Veterans Healthcare card, if you have one, and any private health insurance details. Radiation therapy treatment and appointments in the public hospital are free. If you are being treated in a private hospital, talk to the doctor about costs before you start treatment. If you are worried about any costs of treatment, medication, talk to your liaison officer, nurse or social worker. This page is about your treatment journey and what will be talked about in the next pages in the book. Information about your appointment with your radiation oncologist is on page 11. Information about your treatment planning, appointment and measuring up will be on page 12 and 13. Information about treating the right spot will be on page 14, 15 and 16. Information about your first day of treatment is on page 17. Information about having treatment is on page 18, 19 and 20. Information about possible side effects is on page 21 to 34. Information about after treatment and follow-up visits is on page 36. Planning your treatment with the doctor. Your radiation therapy needs to be carefully planned to make sure the radiation goes to the part of your body that needs to be treated. Your radiation oncologist will make a plan for your treatment. Appointment with the radiation oncologist, doctor. The first step is the appointment with the doctor, called a radiation oncologist. At the appointment, the doctor may examine you and request some scans or blood tests. They may also talk to you about the type of cancer you have, the part of the body that will be treated, why it is recommended that you have radiation therapy, what you can expect the radiation therapy to do, the type of radiation therapy, and the kind of machine that will be used. Planning treatment and when you will start treatment. What position your body needs to be in for treatment. How long will treatment last? Side effects and how you can look after yourself. How your doctors will watch your health after treatment finishes. Life after treatment. Ask the doctor if you can record the conversation on your phone so you can check later what you need to do. This page is about the treatment planning appointment. Your radiation therapist will help prepare and plan your treatment. Treatment planning appointment, also called a CT planning appointment. The planning appointment can take from 30 to 60 minutes. The radiation therapist will take you to the planning area and explain what and who is involved in the session. You might be asked to change out of your own clothes and put on a special hospital gown, which is like a dressing gown. The radiation therapists will use a machine called a CT scanner or CAT scan. See picture on page 13. The CT scanner machine will take pictures of the inside of your body and show the size, shape and place of your tumour. These pictures help the radiation therapist and doctor to plan your treatment. The radiation therapist will ask you to lie on the CT scanner bed. They will talk about your position on the bed and find the best position so the treatment will target the right spot. Next time, when you have scans or treatment, they will ask you to lie in the same position. Please remember to bring along the following to the planning appointment: any recent scans, any x-rays of your cancer, any blood test results. If you are not sure what to bring, it is best to bring everything. For some types of treatment, a dye is injected into your veins by the nurse to give a clear picture inside your body. With your permission, the radiation therapist will take photos of your face or the part of the body that will be treated so they can find the right spot each time you have treatment. Other scans, called a diagnostic CT, MRI or PET, might be needed to help with treatment planning. The doctor can explain these if needed. A CT scanner will be used to help plan your treatment. Treating the right spot. Every treatment will target the same place on your body, so the position of your body is very important. Staying still helps to make sure the radiation gets to the part of the body that needs to be treated. To keep your body in the same position, the radiation therapist might use skin markings, face masks, or body molds. Skin markings. To make sure you are in the same position for each treatment, 2 or 3 small permanent marks called tattoos might be made on your skin using a small needle. This will feel like a pinprick. Each mark is about the size of a freckle. See pictures. You will see red or green lights or lasers coming from the scanner. These lights will be lined up with your skin marks to check your body is in the right position for treatment. During the planning appointment, small permanent marks called tattoos may be put on your skin using some ink and a small needle. These marks will show the right place where the radiation will target the cancer. This page is about planning your treatment. Face mask. If your cancer is on your head, neck, mouth or throat, you will have a special mask made for you. See pictures to the right. The mask has air holes. Radiation therapists will attach the mask to the bed. This mask will keep your head still during each treatment session. Some people feel anxious wearing a mask. Please tell your radiation therapist if you feel worried or scared. They can make changes to the mask by making a hole around the nose, mouth and eyes to help you feel better. They will be able to give you advice to make you feel more comfortable. Often people get used to wearing the mask. Please note, the equipment and machines may look slightly different depending on which hospital you have treatment. Body mold. A body mold is a plastic cushion that helps keep your body still during treatment. When you lie still, the X-rays are pointed to exactly the right place in your body to target the cancer cells. Deep inspiration breath hold. You might be asked to take a deep breath during treatment to help the radiation target the right spot. Radiation treatment does not start immediately after your CT planning. It could take a few days or weeks for the doctor and radiation therapist to work out the best treatment plan for you. Having radiation therapy treatment. We will tell you about what happens when you arrive for your treatment. Before treatment starts each day, the radiation therapist or nurse will tell you if you need to do anything before treatment starts. For example, sometimes people might be asked to go to the toilet or not eat food before the treatment. The radiation therapist will position your body in the same way as when you came for your planning appointment. If you need a body mold or mask, the therapist will put this on you. The skin marks and measurements done during the planning appointment will be used to make sure you are in the best position for each treatment. Setting up the treatment takes 5 to 10 minutes. It may take a bit longer on the first day of treatment. The lights in the room will be dimmed to line up the laser lights with the marks on your skin. These lasers do not hurt. The first day of treatment may take longer than 20 minutes because the radiation therapist needs to check the measurements made during the planning appointment. During treatment sessions. When you are in the right position, the radiation therapist will leave the room. They will start the treatment machine from another room. There are rules around the radiation machines. Other people are not allowed in the treatment room while it is running. You will be in the room by yourself for about 5 to 10 minutes. The radiation therapist will be in the room next door watching and listening to you through a video camera and controlling the machine during the treatment session. During treatment, you can listen to the radio or bring your phone to listen to music. It doesn't interfere with your radiation treatment, but it is important to keep very still. The radiation therapist will make sure you feel comfortable and safe before starting treatment. The radiation therapist will not stay in the room with you during the treatment, but there is a camera and a microphone, so they will be able to see you on a computer screen and you will be able to talk to each other. If you are wearing a mask and cannot speak, you can raise your hand and get their attention if you need to. The machine makes a buzzing sound when it is turned on and might make loud noises, but you will not feel anything. It is just like having a long X-ray. The machine may move around you but will not touch you. You need to stay very still and breathe normally during the treatment. The therapist will tell you when you can move again. It is important to keep very still during the treatment to make sure the radiation gets to the part of the body that needs to be treated. The machine will move around you but will not touch you and you will not feel anything. After each treatment session, the radiation therapist or nurse may talk to you about some of the possible side effects. See pages 25 to 38. They will talk to you about how you look after yourself and stop any side effects you may have from getting worse. You will see the doctor or nurse at least once a week during treatment. If you need anything, you can speak to them at any time. Remember to ask the radiation therapist any questions each time you come in for treatment. You and your support people can write questions to ask your cancer team on page 44 of the booklet. The radiation therapist can ask the nurse or doctor to see you if needed. If you have any side effects from treatment, you might see a nurse who can help look after you. They can put on or recommend special creams for your skin, change dressings, or take blood for tests. About possible effects of treatment. Side effects. The next pages are about how the treatment might make you feel. This is known as side effects. Side effects are different for each person and depend on the part of the body being treated. You can get side effects during or after treatment. Most side effects will go away in 4 to 6 weeks. Some side effects can occur later, but these are less common. If you get any side effects, tell your doctor, radiation therapist or nurse as soon as you start having them. They will tell you how to manage the side effects. If you have any serious side effects, your doctor may change your treatment or give you a break from treatment to give your body time to recover. Your doctor will tell you what effects you may have. Support group. You can join a support group where you meet people who have cancer. You can have the chance to share your feelings and experiences. You can also learn how to cope with your feelings, radiation therapy, and side effects. Telling your cancer care team when the side effects first start means you can start looking after yourself sooner. It might also mean the side effects don't get as bad. Where you feel side effects depends on where you're having radiation therapy. What you feel depends on where the radiation is going in the body. This illustration shows the different areas you might have side effects depending on where you are having treatment. Head, neck, or throat. You may get a dry mouth and thickened saliva, or find it hard to swallow or eat if treated in the head area. See page 29 to 30 for help with mouth problems, or see page 31 for help with eating. Chest. You may have a cough if treated in the chest area. Upper tummy. Your stomach may feel upset or nauseous if treated in the stomach area. See page 32 for help with tummy problems. A little lower. Your bowel or bladder may be affected. and sex may be difficult or painful. See page 33 for help with bowel issues, or see page 34 for information about sex. Body hair. You may lose hair in the area receiving radiation. See page 27 to 28 for help with hair loss. Fatigue. You may feel very tired during and after treatment. See page 24 for help with fatigue. Skin. You may have dry or itchy skin in the area receiving radiation. See pages 25 to 26 for help with skin changes. Your feelings. People experience different emotions when they are having treatment. You may feel worried, scared, lonely, sad, angry, anxious, stressed, frustrated, down or depressed. It is normal to have these feelings, and there are things that may help you. Exercise. Sometimes exercise, such as walking, yoga, or swimming, helps people to feel better, particularly if they are feeling a bit down or depressed. Talk to your doctor about what type of exercise is good for you. Exercise can also lessen side effects of treatment. Talk to others. You may find it helpful talking to someone you trust about your feelings. A family member or close friend, health professional, doctor or nurse, social worker, Indigenous liaison officer, psychologist, psychotherapist, religious minister. You may want to talk to someone who has had radiation therapy and or other people with cancer. However, remember that someone else's experience of radiation therapy may be different to yours. Being physically active and exercising regularly is important to help you feel better. Tiredness and fatigue. Fatigue is the kind of tiredness that doesn't go away when you rest or sleep. Tiredness usually gets worse the longer the treatment has been going on. You will probably feel most tired at the end and for weeks, months after treatment. People experience tiredness in different ways. Some people can keep doing their daily activities, but others may not be able to do as much. Meditate and relax. You may try meditation or activities that make you calmer. That may help you to cope with tiredness from treatment. Listening to soothing music. Spread your activities slowly while paying attention to each breath. Plan to do less things. Some people may need help with shopping, housework, and driving. Do light exercise like walking and swimming. Ask your cancer care team about what exercises are good for you. You can talk to an exercise physiologist or physiotherapist for advice. Meditate or use relaxation exercises, for example, Dadiri, deep listening. Listen to music, read a book. Skin problems, eat healthy food. Changes. Ask your cancer care team on the part of your body that is treated may change throughout treatment. The skin may become red, warm to touch, dry, itchy, sore, flaky, and peel off like sunburn. It might be after 2 or 3 weeks of radiation therapy before you see your skin change. Skin changes may continue after treatment, but usually fade away within a few weeks after the treatment is over. People react differently to treatment. Skin problems and changes vary from person to person. Ideas that may help skin problems after radiation therapy. Protect the skin against the sun. Cover your skin before going outside. Bathe or soak the area using a salt water solution to relieve the itching and soreness, or swim in the ocean. Avoid applying ice packs to the treated area. Shower as normal, but avoid very hot water. Avoid rubbing or scratching the part of the body treated. Gently pat dry with a soft cotton towel. Avoid electric blankets during the treatment. If the treated area involves your head, neck or armpit, the skin is likely to be sensitive, so avoid shaving the area being treated. Wear loose, soft, breathable clothing, for example, cotton. Applying Sorbolene cream, moisturiser, 2 to 3 times daily may help to stop your skin from getting blisters or sore. You may begin using Sorbolene cream from the first day of treatment. Avoid applying any creams 2 to 3 hours before treatment, even Sorbolene. Avoid perfumes, deodorants, cosmetics, or scented creams directly on the part of the body treated. They may contain alcohol or metals. If your skin starts to peel, continue to use cream and ask your doctor, radiation therapist, or nurse for advice. Tell your radiation therapist or nurse if you are concerned about your skin. They will be able to recommend ways to help your skin, for example, special creams. Hair problems. You may lose some or all of the hair on the part of your body that is being treated. Your hair will usually grow back after the treatment is over. Sometimes you lose your hair because of chemotherapy, not radiation therapy. If your face is the part of your body being treated, you may lose hair on the back of your head. Some useful ideas when your head is being treated. Protect your head against sunburn and the cold by wearing a hat. Use a mild shampoo like baby shampoo. Dry your hair with a soft towel by patting, not rubbing. Avoid using hair dryers, curling irons, hair bands, clips or hairspray. Avoid using hair colours, perms, gels or mousse as they may sting your head. Some people wear a wig. You may choose to wear a wig, toupee, hat or scarf, whatever you prefer. If you plan to wear a wig, choose it early in your treatment. The Cancer Council helpline, listed on page 38, and your cancer care team can help find a wig. Some hospitals have a wig library where you can try different wigs to see which one suits you best. Mouth problems. If you are having radiation therapy on your mouth, chest, throat or neck, you may find eating or swallowing food difficult. This is because the radiation therapy can affect the cells in the glands that produce spit, saliva, and can cause a burn inside the mouth, throat or neck. You may have a dry or sore mouth, or your voice may become hoarse or croaky. These symptoms slowly improve after treatment, but may take a few weeks or months. Thick mucus, a lump-like feeling or pain in your throat that makes swallowing hard. Sore teeth and gums, toothache or tooth decay. Dentures may be damaged. Food may taste different and it may take a long time for food to taste normal after the treatment is finished. Some useful ideas if you are having mouth problems. Have your teeth checked before starting treatment to your head or neck region. Have regular dentist checkups after treatment is over, every 6 months. Keep your mouth wet by sucking ice cubes, sipping cool drinks, and drinking water. Drink water often during the day and take a bottle of water with you when you go out. If you smoke, talk to your cancer care team for advice on how to stop smoking. Avoid or reduce alcohol. Regularly rinse your mouth with a gentle mouthwash. Ask for advice. If your throat is sore or you cannot swallow, cut, blend or mash food. If eating is difficult or painful, pain relief medication may be available. Ask your dietitian or speech pathologist if you need a special diet. Talk to a speech pathologist if you have swallowing problems. Loss of appetite and feeling thirsty. Some people may lose their appetite or feel very thirsty. This depends on what part of the body is being treated. People who are having their mouth, neck or throat treated are likely to find it hard to eat and swallow food. You will see a dietitian or speech pathologist who can help work out the best foods for you to eat. It is important to eat healthy food and a well-balanced diet to help during treatment. Speak to the nurse, dietitian or speech pathologist about your food and diet. If you are having trouble swallowing or you have lost your appetite, here are some tips. Eat small amounts of food several times a day. Try eating softer foods like yogurts, fruit, purees or soups if solid larger meals are too difficult. You may need nutrition supplements. If you are going to use supplements, it is important that you talk with a dietitian who can help you use them in the most effective way. Try to drink water, juice or cordial often during the day and take a bottle of water with you when you go out. Nausea. You may have nausea or an upset tummy when your stomach area is being treated. Nausea is usually easy to control with medication. Some useful ideas if you are feeling sick in the tummy. Sip water or other fluids during the day to avoid dehydration. Nibble plain biscuits. Ask your doctor if a medication may help you. Contact your cancer care team if you have nausea or if you are vomiting after your radiation therapy. Toilet trouble. If you are having radiation therapy on your stomach, you may have constipation or diarrhea, loose bowel, which may start within a few days to a couple of weeks. Sometimes you might get diarrhea for other reasons, like food poisoning or chemotherapy. You may have these symptoms: frequent loose bowel motions, watery bowels, stomach cramps, feeling the need to go to the toilet often and quickly. Some useful ideas if you are having tummy trouble. Eat what your body can cope with or handle. Reduce high-fibre food, whole grain products such as whole grain bread, pasta or cereals, nuts, legumes like peas, lentils and beans. Reduce spicy food like hot curries and chili. Drink lots of clear liquids, for example, apple juice, pear nectar, weak tea or clear broth, as soon as the diarrhea starts to avoid dehydration. If you feel sick, eat or drink as well as you can because your body needs energy. Contact your cancer care team if you see blood in the toilet or if you have more than 6 bowel movements in 24 hours. It is important to talk with your cancer care team about your diet. Radiation therapy and sex. Radiation therapy can affect your sex life and make you lose interest in having sex. Your sex drive may be lower because you feel tired, anxious, or depressed. If you are having radiation therapy in between the hips, pelvis, you may have some problems. The problems are different for men and women. Women might find sex too uncomfortable or painful during treatment and for a few weeks afterwards, but this should improve. Your cancer care team may suggest using a lubricant or a vaginal dilator. As lubricants can be made from different things, it is a good idea to talk to them about which is best for you. Itchy, burning or dry vagina. These changes can last for a long time or not go away. Menstrual period changes or menopausal symptoms. These can include stopping of periods, hot flushes, dry skin, and dry vagina. Your period might start again after treatment, but this does not always happen. Men might find having and maintaining erections difficult. There are treatments and tools that can help men have erections. Talk to your cancer care team who can refer you to someone who helps with sexual changes. Pain during sex. For a small number of men, sexual function may not recover. Pregnancy. As radiation therapy affects normal cells, it is best that you do not become pregnant or make someone pregnant during treatment. It might affect the baby. It is a good idea to use a reliable form of contraception while having treatment. For example, condoms, the pill, or an intrauterine device, IUD. You can ask your doctor or cancer care team for advice about the best contraception method for you and your partner. If you want to have a baby, talking to your doctor can help you decide on the right time after treatment. Natural therapies. Some people also use natural therapies to manage the cancer and help them cope better. Natural therapies are sometimes called natural medicines, bush medicine, or complementary therapies. They include traditional bush foods or medicines, massage and aromatherapy, meditation, prayer or spiritual healing, herbal medicine, acupuncture, counselling, art therapy, and music therapy. You may have problems caused by the cancer and its treatment, such as pain, feeling sick, fear, or sadness. You may find that certain natural or bush medicines can help with these problems. The therapies you use depend on what you want to try and what your doctor advises. Talk with your doctor if you want to use natural therapies. Some natural and bush medicines may stop your other cancer treatments from working, while some you can take at the same time. You will need to find the best time for the treatment and natural therapies to work for you. If you want to use bush medicine, also discuss this with an Aboriginal healthcare worker or elder. Life after treatment finishes. Once your planned treatment is over, your cancer team will tell you when and how often you should come back for follow-up visits at the hospital. Soon after treatment, you are likely to have regular follow-up visits with your radiation oncologist or nurse. At these follow-up visits, your team may check for any sign the cancer has come back, new side effects or if other side effects are better or worse, seeing if other treatments are needed. Your cancer care team will organise an appointment with your radiation oncologist, doctor, about 1 to 2 months after treatment is over. After this appointment, you may see your doctor around every 3 to 6 months, depending on your type of cancer and how bad your side effects were. It is also important to see your local doctor or community health clinic to discuss how you feel after treatment. Some people may feel a bit alone after the busy treatment time is over. The cancer care team is there to help and support you, even when your treatment is over. It is important that you see your doctor for a follow-up checkup after treatment to make sure everything is going okay. The cancer care team will talk to you about life after treatment. At some cancer centres, the cancer teams develop a survivorship care plan, SCP, with you and your carers. A survivorship care plan may include information about you, information about your care team, diagnosis details, treatment summary, signs and symptoms to watch for, follow-up care plan, wellness plan. It is important to think about life after treatment and what is important to you. Your cancer care team can help you work towards your goals. About support and helpful contacts. Cancer support services. Cancer Council has many different services for people with cancer and their family. You can call the helpline on 131120. Yarn for Life. Here, you will find information and resources about cancer specifically for Indigenous people. Yarn for Life's website is yarnforlife.com.au. Cancer Australia. Here you will find information about cancer screening, diagnosis of different types of cancer, treatments, supportive care. Specific information for Indigenous people is available on this website, canceraustralia.gov.au. Look Good, Feel Better program. This is a free national community service program to inform people with cancer how to manage the appearance-related side effects caused by cancer treatment. They can be found on this website, lgfb.org.au. Wig services and wig libraries are also available at some cancer clinics. Local support services. Interpreter services might be available if you need assistance with language interpretation in your language. In the Northern Territory, you can call 1-800-334-944. Local Aboriginal Community Health Services. Ask your Indigenous Liaison Officer about local services in your area. Connecting with others. Cancer Connections website is cancerconnections.com.au. Here you will find information about how you can share your experiences with other people. You may want to join a support group or talk to a trained volunteer who has had a similar experience. Indigenous Liaison Officers. Ask the hospitals and cancer centres to connect you with the Indigenous Liaison Officer or Aboriginal Liaison Officer. Family support. Family and friends can be a great support. Family can come with you to visit doctors and nurses and hear what they say. Support for caregivers. Carer Gateway. carergateway.gov.au/. Here you will find information to support family and friends who provide care and support, including accessing financial support, help and advice, taking a break, connecting with other carers. You can call the Carer Gateway on 1-800-422-737. Carers Australia. careraustralia.com.au. Carers Australia advocates for carers and helps provide access to support services. Medical words. Types of treatment. Chemotherapy. Medication to kill cancer cells given as a liquid using a drip or pump into a vein or a tablet taken with a drink of water. External beam radiation therapy. This type of radiation therapy uses high-energy X-rays to kill the cancer cells. The X-rays come from a machine outside the body. Hormone therapy. Hormone therapy is medication that reduces or blocks hormones in your body that are likely to help the cancer grow. This is mostly used in breast or prostate cancer. Immunotherapy. A treatment, medication, that helps a person's own immune system to fight cancer. Internal radiation therapy, also called brachytherapy. A type of radiation therapy that places radioactive sources or seeds inside the body, close to the cancer or area of risk. Often these radioactive sources are taken out after a few minutes. In some cases, they remain within the body. Palliative treatment. This kind of treatment eases symptoms like pain from cancer. It also helps to control the side effects from cancer treatments, such as radiation therapy and chemotherapy. Radiation therapy, a type of cancer treatment that uses radiation, a special type of X-ray, to kill or damage cancer cells to shrink the tumour. There are two types of radiation therapy: external beam radiation therapy and internal radiation therapy. Other words you may hear: benign, not malignant. A benign tumour is not cancer. Cancer, when cells grow in a wrong way, resulting in blood cells that do not work well, or a lump called a malignant tumour. Cells, the basic tiny building blocks of the body. CT scan. CT means computerized tomography. This is a type of medical imaging or scan. In this type of scan, X-rays run over and through the body, and a computer creates a picture of the inside of the body. Contraception. Methods used to prevent pregnancy, also known as birth control. Diet. Food and drink you have each day. Does not mean a way to lose weight. Fatigue. Fatigue is the kind of tiredness that doesn't go away when you rest or sleep. Intrauterine device, IUD. A small device that is inserted into a woman's uterus, womb, to prevent pregnancy, also called an IUD. Malignant tumour. A cancer, meaning that the cancer cells invade or take over the surrounding tissue. They can also spread to other parts of the body. Metastasis. Metastasis. Metastasis is the spread of a cancer to another part of the body. It is also known as secondary cancer. MRI scan. MRI means magnetic resonance imaging. It is a type of imaging that uses special radio waves and a magnetic field to create a detailed picture of the body. Nausea. This is a feeling when your stomach is upset or queasy and you feel like you want to throw up. Nourishment. The food you need for growing, being healthy, and keeping in a good condition. Nutrition. The food and drink you have each day. Pelvis. The part of your body between your hips. PET scan. PET means positron emission tomography. This type of imaging uses a special radioactive substance to look for cancer cells in the body. Simulation. The process to plan the radiation therapy so the X-rays point to or go to the cancer cells and not to the normal cells. Support group. It is a meeting where people share their experiences. Surgery. Removing the tumour with an operation. Symptom. Changes in the body that a person feels and that are caused by a disease or treatments. For example, pain or tiredness are symptoms. Tumour. A lump with cells that grow in an uncontrolled way. Vaginal dilator. A special piece of round-tipped plastic that comes in different sizes. They are used to stop shrinking and tightening of the vagina after radiation therapy treatment. They help stretch the vagina to make sex more comfortable. Vomiting. When you feel nauseous and throw up. In cancer care team and what they do. General practitioner, GP, local doctor. Local doctor who provides ongoing care and looks after your general health. Your radiation oncologist will be in touch with your GP over the course of your treatment. Radiation oncologist. A doctor who specialises in radiation therapy and is responsible for managing your treatment plan and care. Registrar. A qualified doctor who is in training to be a radiation oncologist. They are supervised by your radiation oncologist. You may see several registrars over the course of your treatment. Radiation therapist. A radiation therapist plans and delivers your radiation therapy. A team of radiation therapists operate the machinery that delivers treatment. Radiation oncology nurse. A nurse who specialises in caring for people having radiation therapy. Tells you about what to expect from treatment, such as the side effects and how to look after yourself. Dietitian. Advises you about food and nutrition during and after radiation therapy. Speech pathologist. Helps you to cope with side effects that may affect your speech, voice, or swallowing. Psychologist. Offers emotional support during and after your radiation therapy. Physiotherapist. Helps you with physical problems that may develop because of cancer and its treatment. They may provide advice on different exercises and ways to reduce pain. Social worker. Helps you connect with support services and may offer psychological support. Indigenous Liaison Officer, ILO, provides emotional, cultural and social support to you and your family. Can also help staff to make sure they provide culturally sensitive health services. Can also help organise transport and accommodation. Hospital Liaison Officer. Help patients and or family members understand hospital processes and treatment. Social Emotional Wellbeing, SEWB Officer. Can offer emotional and social support. Acknowledgements. This book is the outcome of a Menzies School of Health research project. Collaboration and communication in cancer care for Aboriginal and Torres Strait Islander people. The 4 Cs Project, improving patient-centred care and treatment outcomes. Funding was received from the National Health and Medical Research Council, NHMRC Partnership Scheme, with partnership between Menzies School of Health Research and clinicians from the Royal Australian and New Zealand College of Radiologists, RANZCR. The Alan Walker Cancer Care Centre in Darwin, Townsville Cancer Centre, and the Icon Cancer Centre in Cairns. We wish to acknowledge the researchers and developers of the original Radiation Therapy Talking Book, 2015, that formed the basis of this adaptation. Psychosocial Research Group, Prince of Wales Clinical School, Faculty of Medicine, University of New South Wales, Centre for Medical Psychology and Evidence-Based Decision-Making, University of Sydney, Faculty of Health Sciences, Curtin University, St George Hospital, Sydney, Prince of Wales Hospital, Sydney, Chris O'Brien Lifehouse, Sydney, Translational Cancer Research Network Consumer Advisory Committee, Trans-Tasman Radiation Oncology Group. For further information, see Smith et al. 2019, a low literacy targeted talking book about radiation therapy for cancer. Development and Acceptability in the journal Supportive Cancer Care. We wish to thank everyone involved in adapting this book for Aboriginal and Torres Strait Islander people. This book is the result of consultation with health professionals, researchers, Aboriginal and Torres Strait Islander people with cancer, and Aboriginal language consultants.